Well, good morning, everyone. It's good to see quite a lot of familiar faces. And for those of you that are joining us for the first time, welcome to the European Policy Center. My name is Elizabeth Kuiper. I'm Associate Director here at the EPC. And together with colleagues involved, Danielle, Brady, and Giulia Torchio, we're very happy to have you this morning with us for this event, which is the final event of the project that we've been doing under the title Navigating Smart Worlds, the Future of Digital Transformation. And needless to say that this has been a very important topic, both during the last mandate, where we have seen a lot of activity ranging from the European health data space, of course, also partly incentivized by the COVID-19 pandemic, where we all learned as societies how important it is to exchange on data and to have data to learn more about diseases. But also, of course, due to the enormous developments happening in tech, for example, also leading to the AI office that we now have in place, and where, of course, it's great to have the European Commission with us this morning to hear indeed about how all these developments play out also during the next mandate. Again, let's see what we have next week with the election of the future Commission President, but I think it's very clear from the strategic agenda that just has been adopted by the European Council that the digital transformation is very important and is high on the agenda. Because the strategic agenda speaks about, and I'm quoting from the document, it's important to have a successful digital transformation and to really continue working. For those of you that are arriving, please feel free to sit here so that we have a bit of seats everywhere. So feel free to perhaps also go to the front rooms if you, So again, the strategic agenda speaks about the untapped potential of data and the importance of making the digital transformation a success. And I think we have been seeing more broadly that the digital transformation is transforming various sectors by incorporating advanced technologies like artificial intelligence, big data, and the Internet of Things. And this is driving efficiency, innovation, but also connectivity and reshaping how businesses operate, how people interact, and how services are delivered. There's really an increased recognition of the value of data in the digital economy and the recognition that the EU generates substantial amounts of it, which is very important. I think also when it comes to the discussion about the place of the EU in the world, also when it comes to competitiveness and also the scale and speed of innovation. So harnessing the potential of data has become, for that reason, a very important priority for the EU. More specifically, smart health, so the benefits of data for the health sector, offer a lot of benefits in prevention, diagnostics, treatment, health promotion, and cutting-edge research and innovation. I think it's very important that for years and years we speak about personalized medicines, and I think especially the digital promise offers a lot of potential to tailoring individual specific needs and preferences, and data really can speed up this development, as we already have seen and are seeing. Smart Worlds therefore really has the potential to also lead to and contribute to the resilience of the healthcare at large. Advanced prevention systems, early detection tools, and outbreak assessment technologies can help society serve better, prepare for future pandemics and for public health threats. And of course, it's important to note as well that notwithstanding the numerous benefits, where indeed we also have been hearing already that, for example, AI can really lead to the increase and the speed up of research and development, so that again, the speed to market can be shortened and marketing authorization can be shortened, which again, I think is huge potential for patients as well. But there's considerable challenges as well. And I think this will also shine through what we're going to discuss in the panel discussion, that in the roundtable sessions that we had, these closed roundtable discussions, indeed, we also spoke about considerable challenges. Key concerns that we voiced and flagged during the roundtables revolve about the accessibility of data, crucial, of course, for advancing innovation, and the complexities of fair practices in data sharing and reuse, but also data solidarity. So there is an urgent necessity to bolster the skills of the healthcare workforce, to really also enhance digital literacy and to make sure that also the healthcare sector and people working in the healthcare sector, as well as the general population, know how to deal with data. So health literacy, I think, is a very important part that together with the promises of data, we should not forget. So therefore, today's roundtable and today's event will focus on how to overcome these challenges and harness the potential of smart health. So we will start with presenting the findings of the projects. So we have our colleague Giulia Torchio here at the European Policy Center presenting the findings of the study that we worked on. And then we will have a discussion led by my colleague Danielle Brady, where indeed together with panelists we discuss indeed both the potential as well as the challenges of smart health. So again, it's great to have great speakers with us. I'm sure, Danielle, that you're going to present them, but it's really good to have you with us this morning. And I also look forward to your input from the sectors that you represent, be it the healthcare sector or perhaps the broader sector working on the nexus between health and other sectors. So thanks again for being here this morning. I look forward indeed to the findings of the study and the moderated discussion afterward. Thank you very much.
Thank you very much, Elizabeth, for those opening remarks, and thank you all for joining us here this morning, both in the room and online, as this is a hybrid event. So delighted to be joined this morning by some wonderful speakers, similarly both in the room and online. So firstly by Michiel Sweerts, who is Head of Sector eHealth, Wellbeing and Aging at DG Connect in the European Commission. Beside him is my colleague, Giulia Torchio, who's a Junior Policy Analyst at the European Policy Centre. And to my left here, we have Sara Roda, who is EU Senior Policy Advisor at the Standing Committee of European Doctors. And joining us online as well, we have Velislava Petrova, who's a Programme Lead Biotechnology at the International Centre for Future Generations. So as Elizabeth mentioned, we're going to start first of all by a presentation of some of the key recommendations from the paper that is now published and is available both physically at the bottom of the room as well, so please feel free to take a copy, and is also available online as well for those joining us online. It is available on the EPC's website. So Giulia, I'll hand the floor over to you.
Hi, everyone. Thank you for being here in the room. As everyone said, I'll be presenting the findings of the study we've done with the support of the Vodafone Institute for Society and Communication. This I'm presenting, as Danielle just said, can be found more in detail in the paper that you see at the beginning of the room, or there's a QR code at the end of the presentation. You can scan it and then access the paper. So without much further ado, I'll be talking about the opportunities and the challenges associated with smart worlds for health today. Before we dive into the meat of the discussion, I just wanted to start with the definition of the smart worlds, because sometimes I get the feeling that it's quite a nebulous concept still. So smart worlds are usually defined as the seamless integration of both the physical and digital dimension, which is usually aided by advanced technology, such as the Internet of Things, or in the case of the healthcare sector, the Internet of the Medical Things. But also critical, deep, and emerging technologies like AI. And with the seamless integration, we create a really interactive kind of environment that has a lot of potential to revolutionize the healthcare sector and healthcare providers as we know them traditionally. So diving into how we got here. As Elizabeth mentioned already, digitalizing the healthcare sector has always been a strategic priority of the European Commission. I think the first mentions of it were in 2015, but I think the major catalyst for change was the COVID-19 pandemic. It spanned across multiple years. It was a global phenomenon, and it spurred everyone, also because we had to self-isolate mostly, to either adopt telemedicine options or to push forward other digital options for healthcare. And most of the countries in Europe really had to innovate in terms of legislation, because there was no legislation on, for example, how to deal with insurance claims when it came to telemedicine. So we really had to witness a change in legislation across Europe. And I think that created the baseline for what came next and what will come next. And indeed, in then 2020, as part of one of the 5 key strategic priorities of the von der Leyen Commission, a Europe fit for the digital age, we had 2 massive building blocks, the Data Act and the Digital Governance Act. As part of the Digital Governance Act, we have the creation of these highly specific sectorial data spaces that are meant to promote data reshare, data reviews, but also cross-cutting and cross-sectoral cooperation across Europe and across borders. These are called the Common European Data Spaces, and one of these is the European Health Data Space, which is actually supposed to be the first one to be rolled out. Now, as you might know, in April 2024, we achieved a political compromise on the text. Now it will have to be officially published on the journal, and then we're going to look at implementation. But implementation, especially of the European Health Data Space, will take a really long time. I think we're assessing between 4 to 10 years time. So it will really take a long time for us to reap the benefits and see exactly where we stand on things. In terms of the benefits, though, we have a regulation. It promotes the creation of guidelines, sharing of best practices, and it creates a governance framework for the data space. So now to the opportunities for health of smart worlds. These are 7, I think, yes, and they're all interconnected. So I'll try to take them together. Basically, the first one that comes into mind when we think about digital tools in the healthcare sector is probably better diagnosis. This is because advanced technology have usually enhanced the recognition, are characterized by the ability of recognizing patterns better than humans do usually. But also this can be achieved by the introduction of clinical decision-making support systems, and those can lead to reducing errors in diagnosis, but also in streamlining the workflows. In terms of other benefits that are really important, especially in light of the other conversation, the just and fair transition, for example, is the increased availability and access to these treatments, and the fact that digital technologies are making them more available, or should be making them more available across Europe and for many different people. We have better prevention, better tracking, but also something that to me was really interesting is the fact that, and maybe this is not really what comes to mind immediately, is the fact that it can really benefit the healthcare sector, for example, in the allocation of resources, which when it comes to healthcare usually are quite limited, for example. It can streamline the work of professionals. It can help them basically support them in their daily tasks, for example, reducing the administrative burdens, which are very important when you work really long shifts and are usually overworked, again, because of lack of resources. But also they extend healthcare outside of traditional spaces, for example, into people's houses. And that can, in the long term, lead to healthier lifestyles and longevity. And that's very important, if, for example, if we think about the demographic changes across Europe and the aging population. In terms of advancing research and innovation, instead, they can lead to discovering new drugs, but also learning how to deal with, for example, antimicrobial resistance. And they can also offer opportunities, for example, in cutting down the cost of research. And as Elizabeth was mentioning, the time it takes for discovering a new drug, for example, and then launching it on the market in a safe manner. However, for all these opportunities, we have as many challenges that come with them. Again, these are all very interlinked, but I think one thing that really came out of the discussions when we were hosting the roundtables was the lack of trust, the underlying lack of trust when it comes to data sharing across Europe. And this is very relevant, especially in the medical field, because health data is very sensitive, very personal data. And there's this feeling that people are really not incentivized in sharing it, and that really undermines the whole premise of the health data space, and it could potentially impact on the benefits. In terms of concrete challenges, we have policy and regulation. I think it comes to no surprise to everyone when I say that the digital landscape is very complicated, it's very fragmented. I think only under the last commission term, we had 23 new legislative proposals that were negotiated and then are now meant to be enforced. So we're looking at massive digital files. And also, if we take into account the fact that we have already pre-existing digital files, the landscape is looking very, very dense and very complicated. But still, we're hopeful that we can promote harmonization and instead of fragmentation. As I said, again, lack of trust leads to privacy and data protection. Well, it's stemming from privacy and data protection concerns. In the latest Digital Decade report for 2024, I think 46% of the European citizens were saying that they perceive privacy and data protection breaches as one of the biggest concerns of their online presence, basically. And that is also because of cybersecurity issues. Of course, with advanced digitalization, it comes a bigger potential for cyber attacks. And especially when it comes to the healthcare sector is one of the ones with basically the majority of attacks. I think between January 2021 and March 2023, we witnessed an incredible, like a skyrocketing amount of cyber attacks on national basically healthcare providers, the website. And I'm Italian, so I remember really well the feeling of trying to access some document and the website being completely down, and then also wondering, okay, what happened to my data? Who has my data now? And this is very sensitive information, especially if we think about the fact that most of these happened during the pandemic. So other than cybersecurity, we have the adoption of innovations. This is crucial, and it's a challenge for many different reasons. We don't currently yet have the infrastructure that we need in order for us to completely digitize the world of healthcare. But also we are severely lacking in terms of skills, and skills not only of the population. As I said earlier, we have an aging population, so not everyone feels comfortable, or not everyone was taught the skills necessary to go online and basically go about their lives just in an online space. But also the healthcare professionals don't have the skills that are needed on the other side of things, on the other side of processes to deal with the increased pace of digitalization. And then we have access and availability. Again, the digital divide exists, and we don't want to widen it, but we want to close the gap. And it's very relevant, not only at the individual level, but also at the regional level and at the national level. So we really want to close the divide across countries in Europe, and not basically feed into it and make sure that only the wealthier or people in cities or in major cities are the ones reaping the benefits of digitalized healthcare. And then we have existing biases and inequalities. Again, no surprise, AI and algorithms are biased, the data sets are incomplete. So we are really looking at kind of a incomplete puzzle picture for now. And we have to understand that we need better data sets, we need better algorithms, and we need better technology in order to go forward. So after finding the opportunities and challenges, we came out with some recommendations. I'll let you read the meat of the thing. Again, these are in the paper that you can find at the beginning of the room. But substantially, we would like both the EU, but also member states to focus on the implementation of the European health data spaces. That's where the money should go for now. And there should be also more support at the EU level. That's critical, but also we need to really look at the implementation, and we need to make sure that there is harmonization with other legislative tools such as GDPR, the AI Act, but also other vertical legislations, for example, in the medical field. Then I'll take these two together. We need to invest in digital literacy, but also we need to invest in digital education for the healthcare professionals. We should not only tackle the skills gap from the population side of things, but we also should make sure that both at the national level, trainings for medical professionals include the strengthening and the developing of digital skills, but also we could do maybe better at the EU level. We could promote further sharing of best practices, but also skills and trainings in order to decrease the disparities across Europe. And then we have, again, investing in infrastructure, and then achieving high quality data sets and prioritizing privacy data protection and cybersecurity measures. When it comes to infrastructure, it's only one of the 4 critical targets of the digital decade, but it's the one of the ones that's most important, because if we think about it, if we don't have the infrastructure that's necessary, there's no data space in the future. So we should really do better on that. And we should perhaps reallocate some funds under the RRF, but also MFF, cohesion policy, and other financial instruments. In terms of high quality data, it should not only be a matter of doing it ourselves, but also we should cooperate with other health data spaces across the world. The European health data space is not the only one. We can develop data sets that represent a chunk of the population, like the worldwide population. So we should cooperate with other regional health data spaces in order to have more complete data sets and to have more diverse data. Otherwise, we really run the risk of, when it comes to health, it really impacts diagnosis, and also it really can lead to unwanted outcomes. And when it comes to data protection, privacy, and cybersecurity issues, which really prioritize privacy by design in tools, we should really vet the providers and manufacturers of tools in the medical field. But also we should ensure, and here we put it down as one of the recommendations, even though it could technically lead to fragmentation other than harmonization. We should, in order to tackle the issue of trust, make sure that patients are given the option for granular consent, which is also aligned with what's said under GDPR. But we should also provide them with the knowledge of what it means, what it implicates, and I think that would really substantially change the issue of trust across Europe. So I think we've now come to the end of our presentation. Again, that's the QR code to access the paper, and there's our emails. So if you ever want to reach out for any question, any further clarification or anything, please always do so. So yeah, that's it for the introduction.
Thank you very much, Giulia. And just to quickly answer a practical question that I see online already about if we're able to send on the presentation, I think that's something that we'll be able to do. So that will be no problem at all. Before we begin with our panelists, both here in the room and online, I'd like to also put in your head to come up with some questions as well. We want to hear from our audience members and participants here today as well, be it questions on the content of the paper or for panelist discussions or any comments that you might have yourself on the recommendations. We will be more than happy to hear from you. So in the room, we will deal with that in the room, but online there's also a question box that you can submit your questions into and we'll answer them here. So we'll then move on to our panelists, and Michiel, I'll start with you on my left, and reflecting on the recommendations that Giulia has so well outlined, what, in your opinion now, must be prioritised in the transition towards smart worlds for health and health digitalisation? And I suppose a second part of that then would be, what role does and can the Commission, and in particular DG Connect, play in the transition towards smart worlds for health?
On microphone. Well, good morning, and thank you very much for the invitation to address this room and our audience online. And thank you again for the paper. I think it captures very well the potential benefits and the challenges that lie ahead. And I think it's safe to say that when it comes to identifying the priorities, the Commission's thinking and the conclusions and recommendations that come out of the paper are very much aligned. I won't repeat what the potential benefits are. The challenges are also well known, and we're coming from a history of, to quote one of the speakers who attended a previous session here, she was mentioning, the lack of cooperation and coordination between authorities, the split of responsibilities, chronic underinvestment, lagging legal development, and strong vested interests. So there's quite a mountain to climb. Nevertheless, I think we already have a lot of building blocks in place. And I think that's what we've done in the last 5 years, is really put some of the fundamental legal building blocks and policy measures in place, whether it's the Data Governance Act, whether it's the Data Act, the whole cybersecurity packages that have been adopted, the EU DI digital identity revision and the upcoming DI wallet, the revision of the MDR and the IVDR, the AI Act, and last but not least, but most significantly for this field, of course, the EHDS. We've also invested significant amount of money already just in the first 3 years, in between 21 and 24, from the Horizon Europe program and the Digital Europe program, upwards of 670 million in innovation and deployment actions. So I think we are putting a lot of the pieces in place, but obviously what's coming up for the next 5 years, implementation is going to be absolutely key. So I very much agree with that central priority that you mentioned, because that's going to make or break whether this is going to work or not. And I think the ambitions are right. I think the EU is right to be that ambitious. But now we need to implement, and that means not just the Commission, but also the member states being fully on board to do so. And just to reiterate, before I mention the 5 priorities that I see as key, central objective, again, I know this will be repeated many times today, but is all about enhancing and, well, maintaining and enhancing trust. That is at the very core of this and the lifeblood, because without that, from the patient to the healthcare professional and to the wider citizen, that is absolutely essential. So in terms of the 5 priorities that I see, I mentioned that they're very much aligned with the paper. Firstly, to scale up and prioritize investments in key digital infrastructures and technologies. We have a lot of digital infrastructures that we've been putting in place at the European level, and we need to leverage that as well. So the high performance computing, the open cloud, the cloud to edge, all of these big digital European infrastructures can be leveraged very much to the benefit of smart health words. And so the European Commission has recognized that, and we see that reflected in, for example, the 2 communications that we had at the beginning of this year on the AI innovation package, and also the communication around biotech. This is really about being able to leverage the potential of artificial intelligence in particular, and particularly Gen AI, and we can use these infrastructures to help innovators, and particularly smaller innovators, to have access to those kinds of capacities, because that is much, much needed in order to do so. And of course, we have our own digital health infrastructures as well, not just the digital health infrastructures that have been established and already were established under the prior to the EHDS, but have now sort of been crystallized by the regulations, but also the additional health infrastructures that we're putting in place. So the cancer imaging infrastructure, the genomics data infrastructure, the upcoming platform for virtual human twins, the ICU data space, all of these will need to continue being developed, but also find a way to interoperate with the structures of the European health data space. And secondly, it's what we like to call the last mile. And this is really about ensuring uptake in the market of digital innovation, and finding ways to ensuring faster and more efficient regulatory pathways, how market authorization and adoption can be enhanced in order to not just stop at deployment after research and innovation and deployment, but really uptake in clinical settings and by patients and citizens alike. At the same time, not compromising patient safety. So we need to bear that very much in mind, that although we do want faster and more efficient, patient safety is always paramount. And so through the use of data that will start becoming available in the coming years, that also helps build the evidence base. And that's necessary to reinforcing trust, but also being able to further provide evidence of the benefits of digital products and solutions that are out there in the health market. In fact, we're carrying out a study now already on the economics of AI in healthcare. We'll probably have some teaser conclusions in the autumn and then published at the beginning of 25. Thirdly, cybersecurity. This was touched on in the study. Don't need to repeat about the vulnerability of the sector, but obviously the security is only as strong as the weakest link. And so with the integration of more and more actors in the provision of healthcare, it's essential that the measures set out in the cybersecurity packages are implemented by member states, that healthcare professionals have the skills and administrators have the skills to be able to understand how to use the products and solutions that are available, and particularly among general practitioners. That's a very important layer of the healthcare chain, which needs certainly a lot of support, because that is where often a lot of the vulnerabilities stem. Fourthly, it's been touched on, skills and literacy. Again, across the chain of delivery. So not just among the healthcare workforce, but among patients as well, which is essential if we are to move to personalized care. Then patients need to be fully on board in understanding that as well and be an active and willing partner in this transformation. The Commission is obviously monitoring this through the Digital Decade report, which was published this month even, where we have a number of different targets. We have the targets among basic digital literacy. We have the recruitment of ICT specialists. And then touched on in the next priority, also the eHealth targets. And the Commission is actively supporting particular masters in advanced digital skills for healthcare professionals, targeting a range of different technologies in healthcare and disciplines to really try and enhance this. Of course, these are some individual programs, but of course, scaling this up at a population-wide level is absolutely essential, and that needs member states to engage wholeheartedly as well. And then finally, a priority is about supporting member states. And this is really supporting them in also their investments in digital technologies, in modernization of their infrastructures. I mentioned the target of enabling 100% of EU citizens to have access to their online health records. We now in the second iteration of this report, we've had 79%, according to the surveys and analysis and scrutiny that we've carried out. But more needs to be done. So this is really about expanding connectivity between all healthcare providers, public and private, is really essential, and also broadening the type of data that is being made available. Most of the data that is now being so far online available is e-prescriptions, e-dispensations, and patient summaries, but it needs to go much beyond that to labs, tests, test results, discharge reports, and most importantly, and that's the category that's lagging behind the most, imaging, which is essential to feeding again the innovation machine. If we want to further stimulate innovation. And then finally, also implementing eID solutions as well to ensure greater authentication of also healthcare professionals, not just patients, to be able to access and have control over their data as is their right under EHDS, but also making sure that healthcare professionals can use this in their professional context too. So those are really the sort of 5 key priorities that we see. And just to underscore once more, trust is the lifeblood that flows through all of those. Thanks.
Thank you very much. And I think we'll have opportunity to come back to some of those perhaps later on in the discussion. And indeed, the importance of trust, I think, is not going to be the last time we mention that in the next hour or so. But Sara, I'm going to turn to you now. And I think mentioned both in the presentation, the paper, and also in Michiel's words there is the importance of the healthcare professionals and the need to have healthcare professionals on board in the digital transition. And we've heard it offers many potentials, such as reducing administrative burdens, for example. But it would be great to get your perspective on what you feel the action is really needed in order to make use of these potentials and see them come to fruition. And also noting that the paper points to the need to invest in smart health education for healthcare professionals. Also to get your thoughts on how important this is and what role the EU can play as well in supporting member states towards this.
Good morning, and thank you again for inviting us to be able to express. And we read the report. It was also very nice and comprehensive on all the points that have been made. And we agree on many things that are included there. In relation, for example, and what we have been hearing today, it's indeed quite important when we prioritize the implementation of the HDS that we need to ensure that the electronic health record systems do not compromise medical ethics. So this will be a key issue for us to make sure that medical confidentiality and patient privacy is protected and safeguarded. The European health data space has many safeguards in this regard, but then when it comes to operation, it's really, and implementation, it will be harder. So it's only the practical that we will see how this will be done in practice. So we have issued in that regard a statement on electronic health record systems, because we face an environment that is becoming more complex. So we have different healthcare scenarios. So we have hybrid practice, telemedicine, and now smart healthcare systems where the involvement of AI, intelligent systems, and so many things are new. And doctors are not working just with one interface. So they have several interfaces at the same time, several softwares. They have one for different purposes, one for prescribing, others for referrals, others for reporting infection diseases, the COVID, the disease registry. So you have everything that combined when you are providing a consultation. And so the interfaces that they are facing, they are still very slow. The functionalities are very little. So for example, they cannot search. Of course, it depends on the hospital or the healthcare system, but the majority, they cannot find or sort information according to diseases. So it's not in a practical manner. Also, the data that in the electronic health record is becoming quite unmanageable. So if you don't have these assistant tools, it will be very difficult for them to work, especially if it is multiple diseases and for chronic care. So just having their PDFs, it's not helpful for a doctor. And you have that a lot in Slovenia, for example. So they need structured data and semantic interoperability, and in order to receive insight from the data. So we prepared this statement on the electronic health record systems, and we were calling for them to be feasible, functional, and findable. And so they have to be efficient, structured, accurate, concise, and of course the information that is there needed to be validated by what we always say, an identified registered healthcare professional. So, and we have these many rights have been given to the patients in terms of the possibility for them to introduce and change data that is in the electronic health record. So this really needs to be done in a way that doctors continue to trust the data that is inserted. Then I think I would also like to call the attention on, for example, in oncology, doctors have to copy paste a lot the same information throughout different softwares. So if we have a technology that is embedded in the clinical pathways, so it has to be, and for this to happen, something that is useful for them, doctors need to be involved in the design of the electronic health record system. So you have to have these multidisciplinary teams. You have to involve doctors from the beginning in order for the design to be according to their needs. So it has to be user-friendly. Also, it has mentioned here, it's important that we inform doctors of that this specific digital solution will support or augment their capabilities so that they have realistic expectations. And one of the things that I take already the opportunity to highlight in terms of, and we have mentioned here the importance of digital skills, that indeed that they do have to advance on their digital skills. And we have defended always that doctors need to have strong digital skills, and they have to be framed and adapt to their medical specialty. So you cannot have the same digital skill for a surgeon than the one from ophthalmologist. So this is different, and you have to take that into account. But you also have to be aware, and this was something that in your report I wanted to bring it to the attention, which was not addressed, was the risk of de-skilling. So with the introduction of AI tools and ChatGPT, we can have very lazy human beings in the future and not developing critical thinking. So we have to make sure that we introduce this technology, we will maintain the critical thinking of the population. And so, for example, in healthcare, some things that have been discussed was that, for example, the ChatGPT in healthcare does not provide the answer, but the response should be in the form of a question, if they have done this or that, so that we do not diminish the critical thinking. Also in terms of the recommendations. So another thing that we would like to mention for your paper is a dimension, a health dimension, when we are talking about basic digital skills. I think it's important, and CPME members were highlighting that the user needs to be aware, and they need to understand the risks of health data sharing, and also when using digital tools are becoming an unhealthy behavior, so digital addiction. So this dimension, this health dimension, when we are talking about basic digital skills, should also be in the back of our minds. And we are also developing a policy on basic medical education. So we have in the past produced a policy paper on the digital competences for doctors, and we have highlighted several that could be important for doctors. And we have categorized in general digital skills, technical digital skills, and the ones related to patient-doctor relationship. But related here, we do agree that doctor needs to have as I mentioned in the past, the strong digital skills. And now we have also from the AI Act, the AI literacy for deployers. So the electronic, the healthcare providers and the healthcare professionals should also have this AI literacy. So we will still have more work to implement that regulation. I think, yes, for the moment, I covered more or less. And of course, the burdens are there with electronic health records. We hope that they also take them out. For the time being, it's more or less 40% of the doctor's time is done, it goes to admin issues. So it's because the system breaks down or it does not upload fast enough. So it's quite complicated also for doctors when the backup systems are not working. So they have to do everything on paper. So we always have to be that in mind. That's what we do if the system is not working, which happens a lot. Yes, so I will stop here.
Thank you very much for that. And I think actually what the point that you rose in relation to de-skilling is quite an interesting one. I think we talk a lot about upskilling and reskilling the workforce in terms of digitalization, but perhaps de-skilling is something that we don't think about, and is perhaps something that we should a little bit more as well. So thanks very much for bringing that into the discussion. And I turn online to Velislava, and thank you very much for joining us. I think it's been mentioned a number of times, both in the paper and during the discussion, with this idea of trust and how important it is, whether that be in technologies themselves, data management, privacy concerns, or indeed cybersecurity. So it'd be good to get your reflections on how you see this and how you see what actions are needed to build trust amongst populations to ensure that actually smart worlds for health can become a reality.
Well, thank you, Danielle, and thank you for the invitation. I hope you can hear me well. Can you?
Yep, we can hear you well.
Thank you. Sorry I can't be with you, but I'm not in Brussels today. First, I would just say that I represent the International Center for Future Generation, which is a relatively new organization in Brussels working on risk-aware policies for technology. A lot of the topics we are discussing now really require thinking about the potential risk, articulating them, and kind of finding ways to overcome them to make sure that we'll make the best use of technologies. And a lot of this comes into this conversation. I wanted to address the aspect of trust, and already has been kind of intertwined in the responses of the other panelists. But for me, trust first is about a sense of security. So we have to make sure that smart worlds are safe worlds, and people see that relationship. And there's a whole element of what is safety, and it comes from, it's impossible to create a world in which there's no risks. And any technology could come with risks, just like any intervention or anything we knew that we're introducing can have risks. The question is, how well do we understand them? How well are we able to articulate them and work around them and kind of mitigate them? So for me, there's a whole element of the safe use of technology and safe tech aspect that we need to understand and have dedicated research on. There's very interesting, if you look at the AI field, where there's a huge amount of R&D funding, only 2% of it goes to safety research around AI. And it's quite telling considering the amount of cash flow that goes to this area. So we really need to have an opportunity, particularly with the time where we are in Horizon Europe and where the interim revision of it, to think of whether you can play a role in more dedicated effort on safety research, very concretely about specific technologies that would contribute to health, but also to other areas. Can we do research on those, and not to sound alarmist or anything, but just to create that sense that we have looked in the evidence, that we are understanding it, and apply a typical research logic to technology. And I think that's really a niche where we could take, with the capacity that we have already existing, both financially in terms of research funding, but also with the knowledge of our research community in Europe as well. And there's a whole kind of element of whether we apply this specifically to the health application of AI and other digital tools, but also more broadly to emerging technology. I think there's a whole research area that can emerge from this about safe tech. The other element to this is about how do we, once we start thinking about the implementation, and I agree with previous speakers that would be a kind of an important milestone of how do we get it in practice. And I've seen in previous events, by discussing with clinicians about the use of AI in health or digital tools in health, there's not enough clinical trials in the very typical way in which trials are designed to try to assess the utility, the safety, but also the pragmatic and practical ways in which digital tools can be used in a typical workflow of a doctor. When does an AI-based imaging happen in a journey of a patient? When does a doctor come in place? So all of this around a very practical use of these digital tools in the health practice and in the clinical practice of a doctor can be tested in a bit more kind of coordinated way through dedicated, even in small-scale clinical trials, where we would establish what are the best standard operating procedures, what are the best way to implement those, to make sure that we make the best use of the technology, but also the doctors are comfortable with and the patients are as well. So there's a bit of maybe a kind of modified thinking of clinical trials, but really that pragmatic implementation element needs to be handled a lot better. The second part for me is trust is about familiarity and experience. Usually we trust things we know. And I think you've touched about this point of literacy, and it's in your report as well, which I think is really important. People tend to be skeptical to things they don't know. And the literacy is as much about general use of technologies, because it's actually, we're in a very interesting contrast here, where people happily use technology in terms of tools like ChatGPT in their lives, happily share information in social media, but then feel very vulnerable suddenly when these same tools are applied to health. Although I would argue there's a lot more vulnerability in using your voice in a video that can be misused in another way than it is to share what was your blood count 3 days ago. I mean, but there is a different element of kind of familiarity with certain applications. So I would say the overcoming of fear and mistrust has to come with that literacy aspect. And for me, the literacy comes also with incentives. So it's not just about something new you need to learn, but what can you get out of it? Because the reason why people use ChatGPT is because they feel they can do things faster. They feel they can do things more, it makes them more powerful. And I think we need to articulate what using these tools in health would actually benefit us with. And you articulate a lot of this in your report of what are the positives and incentives about precision medicine, preventative medicine, and so on. We need to really make it even more concrete for people. If you have a shared data space and ability, that step towards being able to participate in clinical trials that happen that can give you access to new medicines that currently might happen in individual member state where you would not be able to participate in, or being able to get access to certain precision medicine tools that would not be possible unless you had that kind of individual view of your records as well. There's even, I mean, thinking about each country in Europe has its own transplant database, and we do not have ways to share this across countries. Why not? There could be ways to really try to think very practically about how would individual citizen benefit to increase their health outcomes if the certain level of kind of centralization of data happens, and it shouldn't be just purely you need to subscribe to it and do it because it's good, but it has to be, well, there's certain things you can't do now because you're within your country context, which you could do if there was a common resource. And I think we need to be better at how do we articulate that. And then finally, for me, is in terms of the trust in the end is emotion. And that's why I said that we might feel much more comfortable to share data that is otherwise might be even more sensitive than health data. But it's not really something that we have the same emotions to our health. It feels very personal. And that's why the relationship between doctor and patient is different from the relationship between a specialist only and a recipient of knowledge. It's the doctor in whom we entrust to tell us what to do. And I think that's why in order to get, and of course, technology doesn't bring that emotion. It could tell us how many images has an AI looked at in order to tell us what the probability rate of an error is, but doesn't make it more credible to me than a doctor I've seen in the last 10 years. And I think that relationship, the way to address it has to be something that is we're quite well aware of. And for me, the way to do it is to really work with the healthcare professional who will be the intermediary between patients and technology, to be the early adopters, to be the one that actually understand why is it important to use these tools, how they can be further enhancing their ability to provide best care for their patients. And once we have the adoption of them and the trust in them, then we can have patients also to really kind of be guided to this. And for me, that's important in the context of if you look at interventions that have been here for decades, like vaccines, even though we've seen them working for many years, when COVID came, there was even more skepticism because it's a new vaccine. And sometimes it was fueled by healthcare professionals also not being too sure about how they feel about this new technology. And I think that kind of very little uncertainty that can come from healthcare providers can translate into complete lack of acceptance in patients. And we need to really manage that relationship very well. So for me, these are the kind of pillars, really: security, familiarity and then the emotion and the trust transfer from a doctor to technology. But really commend you on the report. I think it really puts forward very, very important recommendations and a lot of food for thought and action for all of us.
Thank you very much for that. And I think the idea of familiarity is very important as well. It's almost impossible to trust something that you can't understand. And I think given a lot of these things are quite complex, that is a challenge that we will face in the upcoming years with the emergence of new technology as well. And the importance of the patient healthcare professional relationship. I think perhaps the challenge sometimes is that people see that might suffer as a result of digital technologies, when in fact it is actually more important than ever before in order to broker that trust. And then going back again to the importance of upskilling and skilling healthcare professionals is actually important in order to broker trust with patients and broader population. So it's a catch-22 whereby everything is related, and this is why we need an approach that touches on everything to mitigate a number of the challenges that we've identified. Giulia, turning to you again now, and we've heard of many of the developments that have happened in the realm of digitalization and health during the previous mandate, and we're heading towards the next mandate, of course, in the next legislative cycle. But what now must be prioritized? We were at this point now where we have had lots of policy of legislation, but what do you foresee as being important? And I'd also ask for you to prepare any questions that you might have, because we will open the floor up as well in a moment.
First, I want to thank everyone for the feedback on the study. It was great. Everything was noted down. So thank you very much for your insight. This has been a wonderful conversation so far. In terms of what needs to be prioritized for the future, I think everyone mentioned it already, implementation and enforcement. As I said earlier in the presentation, I guess we can maybe now almost call it the first von der Leyen Commission. We really saw a shift towards a more assertive digital policy. There have been a lot of new files, and there has been a lot of effort and development in that field. But now it's really the time to not passively sit down and see how things play out, but really to actively monitor how every file will be implemented and enforced, but also how we really need to think about all these files as puzzle pieces and how they're going to interact with each other. There's overlappings, especially in the field of healthcare, on basically every different file. Like if you look at the AI Act, for example, I don't know if maybe I have missed out on this, but I don't think there has been a lot of actual conversation on what is the implication of the AI Act on specific uses in healthcare, for example, like actual concrete examples on this. So I was looking into this yesterday, and as we all know, the healthcare systems uses basically almost all fall into the high-risk category, so either Annex 1 or Annex 3. But concretely, I was wondering, okay, what exactly, what are the implications? What are the things happening in healthcare that would be regulated by the AI Act? And sorry, I need to find my, basically there's two main fields. And the first one is access to enjoyment of essential public and private services. So for example, to give you concrete examples, things that would be regulated in the healthcare sector under the AI Act are the healthcare determination eligibility, to make sure that there is no discrimination in that. But also emergency patient triaging, basically the allocation of resources when it comes to healthcare emergencies, especially in hospitals. And then there's the field of non-band biometrics, so biometric categorization based on sensitive attributes and how we regulate that. So these are some of the things that for now fall under the scope of the AI Act. And then we have the EHDS regulation, and then we have also vertical sectorial regulations. We have the DGA, the DA. So we really have to focus on implementing them, see how they play out individually, and then we also have to see how they play out with each other. And in those terms, we already know that there are some things where we can monitor for development, some critical areas of concern. For example, when it comes to the AI Act, everyone is pointing out that the definition of AI systems is a bit vague. So for example, developers and providers of AI, there could be some issues, some sort of uncertainty, whether you fall within one category or another, or whether you can be basically, if you're liable to comply with the act. When it comes to the EHDS, it's a very nuanced, granular regulation, and I think, at least on my side, it was very welcomed. But at the same time, it leaves a lot of leeway to member states. And in this current political landscape, we really have to see what happens next and what member states will do. So we know that there is either potential for increased harmonization or more fragmentation. So we just have to monitor. But then there's also the field of unknown unknowns, and things that we don't know are coming, and things we just have to wait and see. And just basically my suggestion would be, in the implementation phase, we really have to be on the lookout for them. We really have to actively monitor possibly unwanted outcomes that we were not foreseeing. And then also in this active monitoring phase, I think we should not forget, and I think this was also mentioned by everyone else, the importance of achieving the digital decade targets. These are fundamental. Without skills, without infrastructure, we don't have the data spaces. Basically, we're not just going forward. And I was reading the latest report the other day. I really recommend it to everyone. I really enjoyed it. Maybe it's not narrative, but I think there's some really key outcomes and key takeaways from the report, and mainly the fact that we are not advancing as much as we should on skills. For example, I think we're either 2.5 or 3 times under what we should be doing yearly to achieve the targets by 2030. So that's quite concerning. In digital infrastructure as well, we have been performing better, especially when it comes to, for example, 5G coverage, but we are not doing as well as we should. And also investments and yeah. But also another really interesting point, because we have been talking a lot about skills, and I was having this conversation with someone else in another meeting recently, and it was basically about being creative when you think of skills. And I really enjoyed your point on thinking about the skilling. For example, we always talk about reskilling and upskilling, but we are not creative in thinking about even retrofitting on skills. And someone was telling me that maybe we should apply this creative thinking in thinking, for example, about the metrics themselves. Like, we're looking at the amount of people who are digitally competent across Europe, but what would change if instead we were looking at the picture of people who feel digitally confident, people who have the skills and who apply them every day and don't go out of their way to, for example, not interact with computers or anything like that. Like, we should be really looking also at other metrics, and maybe perhaps the picture would change, maybe for the better, maybe for the worse. So yeah, I think my key takeaways, the most important things are implementation, enforcement, and in those contexts, we should focus on cooperation, coordination, and promoting synergies, and then we should really focus on the digital decade targets. I think those are the things underpinning really advancement in healthcare, but also in any other digital sector.
For sure, and I think it makes the point that there's lots to be done. We've come far, but we can't sit back and relax now. There's so much more work to be done, particularly when it comes to implementation and also skills. But I now open the floor and ask if there's anyone in the room or online. We have some questions coming in online who would like to pose a question or reflect on some of the things that have been mentioned here. Yeah, I'll first come to a question online and then we'll do that. But just in terms of implementation, because it follows on from what Giulia was saying, and the question is, in case not all member states are equally on board, I think this might have been in relation to the European Health Data Space, but we can look at it more broadly as well. Would it be better to go with the speed of the slowest, or rather create a group of piloting countries? Michiel, maybe I'll start with you first on that question. Yep. So yeah, are we better to go at the speed of the slowest country or to create a group of piloting countries?
I'll give you an ambiguous answer. I would say it's both. I mean, it's true that, maturity among member states is not uniform. So there really are, your leading countries and your laggards and all those countries in between. So to go at the pace of the slowest would, I think, be to the detriment of patients and citizens and healthcare professionals alike. So I certainly wouldn't advocate that. At the same time, of course, you don't want to make sure that they're left behind. And in that sense, being ambitious and having an ambitious program is, I think, the right way to go, because that raises the level for everyone. And encapsulating that in regulation is important. If you left it at a voluntary level and just said, well, let's pilot among just the best, I think we've kind of seen that. If you look at, for example, the use of the cross-border health data infrastructure, My Health at EU, you know, even now, today, there's only 14 countries that are connected to that. So I think it's a positive that has become a mandatory element of the European health data space to ensure that we move from a situation of 14 to 28. But at the same time, the good practices that are emanating from the leaders need to be able to, I don't want to use the word trickle down, because that suggests a certain slowness and also a limited quantity, but they do need to cascade down to the countries that are behind. And that is where I think ensuring that the right structures for dialogue and coordination are in place. I mean, certainly the eHealth network, that is the network at the moment that is for the digital authorities of member states, will morph into the European health data space governance structures. That is a place where a lot of trust has been built up between member states' authorities, and I hope to see that accelerate the exchange and the coordination and the trust between member states to further raise the game. I don't know if that answers the question, but I'll leave it there for the moment.
No, I think it does, and it's about a combination of approaches. It's not just necessarily going at the speed of the slows, but making sure you also bring those member states with you to avoid inequalities that are already present, and that they're not exacerbated in terms of moving towards digitalization and more digital systems. Sara, I know you wanted to come in again, so
yes. So it was just to bring also a few points in terms of the implementation and the exchange between sectors. So I think it would be quite important to use data from the environment, so environmental data for air pollution, water, and this is already being used, for example, by the French Health Data Hub, which is probably the future health data access body in France. And they are already studying the impact of environmental data on health, so on kidneys, lungs, diabetes, hypertension. And so this can bring new studies and new ideas of prevention and promotion. So that would be, I think, one of the priorities to use. And another thing that we have not talked today was about the need to consider digital footprint of digital archiving. So we are consuming a lot of data. There is a lot of data centers. We have no idea how much data we are consuming. We just need to build more and more data centers. And this is becoming very heavy to manage. And just to give you an example again with the ChatGPT, every time a person uses a ChatGPT consumes 25 times more than a normal search in Google. So we are consuming a lot. We have no idea. And this is something that we need to understand our digital footprint when it comes to digital archiving. And I think the Commission is already financing some studies on this, the eArc, which is doing it. And one of their key messages is that when we are introducing and I think this would also be important for the electronic health record systems. When we are developing, we have to have an idea how much already calculate, how much that would cost in terms of carbon footprint. So we have to calculate, reduce, and compensate. And so compensate could be also other projects related to the environment that help, because if we do the digital transition, we cannot forget this part. And another point that we also did not talk, but we always do and have to talk, is the digital divide, which is also related to the digital skills, to make sure that we don't leave no one behind. And at a certain point on your age, or even so you have more difficulties interacting with the digital. So other alternatives should always be there, so that you do not force, and that you only mean that you have to speak with a doctor when, or to access your electronic health data would be digital. So we have to make sure that alternatives are there. And then a final one, just in terms of training for doctors, one thing that they always say is that it's important when it is hands-on training, it happens during working time, because this facilitates implementation, and not again then working after hours and catching up on this kind of training.
Thank you very much. And I think the point you made about how the European Health Database, for example, might interact with other databases is very interesting, and how that might transpire, as hopefully we will have more databases in the years to come, and they can't be something that happens in isolations, but need to be able to interact with each other. And that's something we also looked at DPC in the context of our planetary health project. So how environmental data, agricultural data, and how those things all need to actually come together for better outcomes. We have another question coming in online here, and I think we have one in the room. So we'll take the question in the room here, Fionn.
Hi, Fionn from DSW, we're a health NGO. Congratulations again on the report, and thank you for the insightful discussion. Just picking up on the challenge that you highlight in terms of exacerbation of existing bias and inequalities. I regret to not see sex and gender there as a lever of bias in data. If we look to COVID-19, for example, only 60% of countries disaggregated data by sex, and we have huge issues in terms of sex and gender blindness in the existing data sets that we have, and so huge issues in terms of those being exacerbated as we feed the machine, let's say, in that way. I wonder what role for the Commission in this, in terms of looking to existing data. Can there be funded research to look at the data that already exists, to disaggregate it by data and also by gender, which is even less done but so important, such a powerful lever of health disparities. I'll leave it there in terms of sex and gender, in terms of the data and how we feed machines, but also has huge implications as well in terms of novel mechanisms for efficiencies, particularly in research. When we mention virtual twins, we know that has huge potential for eradicating some of these biases. So just wanted to bring up that element. Thank you.
Great to start here with that question, Michiel, and pointed to you, and just to also note as well, totally agree with the importance of the sex and gender disparities that exist within the data sets.
Thanks for raising that. No, I mean, absolutely. In terms of, I mean, when we're talking about smart world here, we should not obviously limit our discussion to just making more and more data available. I mean, the quality of the data has to be really above board. Removing biases from algorithms and from all the training is, of course, absolutely essential. I mean, in the big digital health infrastructures that we are funding, that those dimensions are very, very present. I mean, that goes without saying, but I certainly welcome further suggestions for ideas for areas to look at. So happy to talk to you afterwards. Yeah.
And if anyone else would like to reflect on the need for diverse data, either if anyone else would like to come in on that point. I didn't understand the question. Oh, on diverse data and the need for diverse and quality data.
Yes, so in healthcare, you have indeed several different types of data, and doctors, the way they write for that specific patient and for that specific disease. So they are not writing in view of research purposes for a second view. So this will also have they will have to learn, or perhaps when they use the codes, because doctors always write in codes, how to make this in a way that is helpful also for research. So now there is a lot of debate on the clinical conversions of electronic health records. So who is more into this in the techie part? Open EHR and HL7 Fire have decided that some of their standards could come together, and I think that is the right direction, so that we don't have different standards for the electronic health records. So indeed, in terms of data quality, that is an issue on how we make it for secondary use purposes, and how to combine. So you have, as we were already hearing, a lot of fragmentation and disparities. Some are more mature in terms of digital, others not. So that is, again, another challenge to take care of, indeed. But we should not forget always, if we see this health, and you had in the recommendations, as an investment, and we should invest in health and not so much seen as a cost. We cannot forget about other issues that healthcare has, so especially the health workforce shortages. And so also, we also ask is, please do not forget the investment also in the health workforce, and not only on digitalization. So the budget line cannot be reduced just for digitalization.
Yes, investment is key, and I think how we view investment as well is important. That it is seen as an investment rather than a cost, in terms of digitization, and also to make sure that it doesn't mean that we just divert investment into one area, but that we look at it across the health ecosystem. I think Velislava, you were to come in.
Just very quickly to reflect on that point about diversity in the data and the quality of the data. I think that's why I pointed out to the need to have clinical trials. Sorry, there was something that appeared on my screen. To have clinical trials, because there you do have to take into account how representative is what is the data that you use, the patients that you treat, and that kind of logic that typically is applied. All of these questions used to come in genomic studies when people were doing genome-wide association studies, and how representative the genomic data of the different populations. And there are ways in which one can tackle them in a very research logic, but it requires a very dedicated effort to how do we design all of this studies and research to be able to understand where the biases can occur, because sometimes they're very different from the typical biases we are used to. So whether it's a new version of a software can be a bias that is introduced, that is something that we didn't have before as in a bias of a study. So I think that's requires that kind of research approach to the implementation of these tools, because then we would address this. And this touches to a point that I want to make earlier about that. Apart from smart rules need to be safe, smart rules need to be equal. And that is that issue of representation as well, both in terms of knowledge and capabilities, but also in being involved in when this evaluation of certain tools happens.
Yeah, it's across the whole life cycle, looking at from the very beginning of research through to conceptualization, implementation, how we try to mitigate biases that already exist, but to also make sure that we're not introducing new ones as well. We have another question online coming in, and Sara, you might be best placed for this, but it's given the difference between the rate of change from AI moving at light speed versus the rate of change from policy changes moving in say 4 to 10 year time horizon, which has been mentioned by some of our panelists. What do you think is a realistic first program on digitalization for a group of clinicians such as nurses or GPs, so that the time frame, I think, in terms of the mismatch perhaps between the speed of the technologies and the policies, and what that means then in terms of skills for healthcare professionals?
Well, I think one of the things when you are introducing AI in a hospital setting, you needed to do it at more or less local level. So you had, I think it was in Taiwan, the way they introduced AI in hospital, they developed AI hub a center where AI projects would be discussed. They would, of course, have doctors on board. They would see the needs of doctors, specific needs on that hospital, what would need to be enhanced. It also relates to the priorities of the hospital, what they can tackle, what kind of diseases. And then they developed AI projects in accordance with that. And they had a huge success also in terms of doctors' adherence and motivation. So that is also another key part, that you have to motivate doctors to engage and to try these new digital solutions. But the way to do it, you have to not debundle, but demask the complexity that AI brings. So, or all the troubles, and to demystify actually the introduction of AI. It's not that problematic. And so you have to have training. They had implemented in this hospital in Taiwan a lot of training ahead of introducing the AI project and the new technology, to explain what it was, what it implied, the relationship with the patient. And then doctors felt motivated and could cooperate and introduce new ideas. And so it became a huge success. So I think it makes a difference when you look at the local needs and you go from there, from specific local needs.
Yeah.
I just want to touch on that, and it's also in relation to something Velislava was saying. This is a great example because, again, you say it happened at the local level, and I think that one of the really important considerations that we need to take going forward is the whole storytelling, which will be really essential. Coming back to this question of winning trust and confidence, is finding those examples of benefits, of successes. I mean, certainly from a commission perspective, that's really desirable. I won't admit to saying, well, we already have lots of examples, because we're still in the process of developing and deploying our big infrastructures. But it will be great at some point in the future if we can also say, well, this person benefited from this breakthrough that came as a result of that infrastructure being there and that sharing of data and so on. That's at an EU level example, but there are so many different types of examples that can be had for citizens, patients, and even doctors, to show how something benefited and worked. And I think that will be a really important part of communicating this for the benefits going forward, and to gaining that public trust. So just wanted to add that.
Yeah, being able to have those tangible examples as well, so people can kind of understand exactly what the benefits are in more than just words, will be important. But of course, we also have to get to that point as well first, at the EU level. But I think it's also, there are lessons to be learned, and I think using an example of somewhere like Taiwan to also use those examples and see what we can learn at the European level from them as well is most beneficial. And we are really coming close to the end. We might be able to take one final question. If there is no one really eager to come in, then I think we can end the discussion here. And I'll end up by thanking all of our panelists very much for your contributions this morning, for your reflections. I think it's given us even further food for thought for our next steps on our further work on health digitalization. I think we'll have much to discuss and to think about afterwards. So thank you very, very much. Thank you also to everyone who joined us here in the room this morning, and to everyone who joined us online. As I mentioned, for anyone who's here in the room, please feel free to take a publication along with you, and we'd also be happy to get your feedback at a later date via email or whatever way it works for you to get in contact with us. And also online, you can get our publication on the EPC's website. And likewise, happy to hear any reflections or further feedback you might have. So thank you very much, and have a lovely rest of the day.